Good morning.
Good morning.
This is Dr. Paula Duren, and I'm with Universal Dementia Caregivers. And during this time period, we have dedicated ourselves to sharing information for caregivers and people who have questions about COVID-19 and issues that caregivers are facing right now. Our guest this morning is Rosilius, and you tell me, Ro, if I said it right, Goodson. He's a vascular surgeon, physician assistant, working at Beaumont, Royal Oak, on the front line, supporting loved ones, our loved ones, as they come into the hospital with COVID-19. First of all, let me say welcome and thank you so much for your service.
Thank you. Thank you for having me. I appreciate it. Thank you.
What I'd like to do this morning, we can go back and forth and somehow split the screen. A number of caregivers have sent questions in to us, and I would really like to get your thoughts on them. Just a general statement first. How are you doing and coping with this whole situation yourself?
So far, so good. I mean, doing well. I'm doing, and so now with the, I should say the cases are now starting to kind of level off. It's just, you never can tell when you're going in. But right now, I mean, we're coping. We're actually have get off the ventilator, I should say, and now out of ICU. So it's going.
Okay. Well, again, thank you very much.
Thank you.
As you know, we have a number of caregivers out there, and we service primarily caregivers supporting loved ones with dementia-related diseases.
Yes.
But this information is relevant for any caregiver that's there. And with the social distancing and basically being in the house, our caregivers are by themselves, oftentimes supporting a loved one. If I were a caregiver somewhere all by myself, what initial advice would you give me, just as a person aware of the situations going on? What starting advice would you give me? And then I'll ask you the specific questions that I've been given.
So as a caregiver of someone diagnosed with COVID, or just a caregiver?
Just a caregiver in general. Let's start there because they are all having different kinds of emotions right now. So any kind of general guidance, because they might be supporting someone with COVID and don't even know it.
Okay. Yes. Great question. So I would basically say, just right now, if the caregiver or the person they're taking care of have chronic illnesses or are what we call, well, right now, COVID has no age limit. They do say, our older patients are therefore getting COVID. But however, we're seeing young patients getting it as well. So as a caregiver, I would basically say, you need to continue to wash your hands. I would basically say, disinfect the home. When I say disinfect, I mean just wiping down doorknobs and cleaning different surface areas. Having a mask and gloves are very helpful. And this is with someone with COVID and without as well. You want to limit the exposure of the person that you're taking care of. You want to limit them from going outside, exposing themselves to the environment and to other people. So I would say, have a mask, have gloves before you go out to any place, as far as grocery stores, as far as getting gas and things like that. So as a caregiver, yes, you should definitely treat this as you're isolating yourself as well. And so disinfect, gloves, and mask.
Great, thank you. What should I look for in terms of symptoms in myself or symptoms in my loved one that would suggest to me that they might have the COVID-19 disease?
What we're seeing now is a dry cough, a low-grade fever. We say low-grade, I mean, it's starting at 99, anything over 99.1. Dry cough, like I said. We're seeing also shortness of breath, worsening shortness of breath. And also seeing, some GI symptoms such as diarrhea, abdominal discomfort, and also loss of taste and smell.
Okay, and it's interesting you say that taste and smell because that information seems to have come along a little later.
Correct.
Initially, I didn't hear anybody talking about taste and smell, but it sounds like as you all learn more, you share more with us.
That's correct. That's correct. Initially, it was just dry cough and fever with some shortness of breath. But we're seeing, like I said, a lot of GI symptoms now. So we're seeing a lot of the loss of taste, the diarrhea, the abdominal discomfort.
Okay. Now they talk about high risk groups, and I know that older adults are considered part of the high risk group. But
Correct.
what are the other high risk groups that you've identified or that have been identified?
Yes. So that's those with heart disease, coronary artery disease. May have had a heart attack in the past. Um, Arrhythmias that they may have, which is abnormal heartbeats, with diabetes, obesity, those who are immunocompromised as well, such as maybe cancer patients and things like that.
Okay. Now I am a kidney transplant.
Yes,
Would I be considered a high risk person?
absolutely. Absolutely. Transplant patients are definitely on our front end as far as being immunocompromised. And, with being a heart transplant patient, you do not want to affect the kidney and have it rejected. So, yes.
Okay. Now, Ro, one of the things I have to do as a caregiver is I need to get groceries.
Yes.
And at one point they didn't say wear a mask. Now they're saying wear a mask. They're saying be concerned about what you touch. How should I prepare myself to go and get groceries?
Great question. So I prepare myself as if I've been exposed and those around me have been exposed. So I basically, I wear gloves, I wear a mask, I wear glasses as well. So, it's an eye shield.
Okay.
But yes, I wear, I definitely put my gloves on and my mask. Not necessarily in the car if I'm by myself. I don't need to. As soon as I get out of the car, I am putting on my gloves and I'm putting on my mask. So I should say, tell everyone as soon as you leave out, definitely if you're going to the gas station, gas pumps are very, very, very filthy. So, I would definitely tell them to wear gloves with that as well. But yes, you would not see me out the house without my gloves and my mask.
Okay. Now, there's a lot of talk about the virus can stay on various surfaces for different points in time. I now have my groceries. I have them in the car. I'm on my way back in the house.
Yes.
What should I do as I walk into the house with these bags and the mask I have on and the gloves I still have on?
Yes.
If I'm supposed to still have my gloves on.
Yes. So as you get into your car or your vehicle, you should definitely take your gloves off because you can transport different, bacteria that were on the gloves from the buggy or from the groceries onto your steering wheel, things like that. And so I usually go ahead and take my gloves off, discard those gloves, don't reuse those gloves, discard those gloves, and then I take my mask off. However, when I get home, though, I place my groceries on the floor. A lot of times we go straight to the counter, we put them on the counter, and then we just start unloading, taking milk from the bag straight to the refrigerator. And so in this case, I don't do that. I put those on the ground, and then I have a disinfectant wipe. Now, if you don't have disinfectant wipes, you can use a bleach solution.
Okay.
That consists of like a teaspoon of bleach to 200, they say 250 cc's of water. However, if you have a 1 liter can, you can do, it's like a 1 liter bottle of water, and you can put in about 5 teaspoons of bleach. That solution I wipe down with a disinfectant wipe. I wipe down everything that I place in my refrigerator as well as in my pantry.
Okay. And I found a really good video. If people are interested, I can put that reference up. A gentleman showing how he unloads his groceries and doing much of what you suggested are necessary to try and remain safe. Just another question. Right now, can I get a test? Because we keep hearing on television, you need a test in order to know this, but you can't get a test, and tests are short. We have a shortage of tests. And then there's some other kind of test that they're talking about that we need. So what are these tests, and can I get them? Can I get them?
Yes, right now, the city of Detroit are offering tests at various testing places. I know at Beaumont it was a little different. We had tests, but we had limited tests. And so those, a lot of people were not getting tested, but at the same time had symptoms. So we were sending them home, quarantining them because they had symptoms. In this case, though, now in Detroit, I do know of one. They have a couple of them, but I do know one being the State Fairgrounds. You can go there to get tested. However, you do need to call the scheduling line. At that time, you would need a prescription for testing from your PCP. And when that prescription can be emailed to you, it can be hard copied to you as well, or the physician itself or the physician assistant, nurse practitioner, they can actually call the hotline and order that themselves for you.
Okay.
And they'll give you a scheduled time, and then you just meet right up at the State Fairgrounds at that scheduled time, and you can get tested.
Now, you talked about quarantine.
Yes.
What exactly is quarantine, and how do you quarantine when I'm the caregiver of a loved one who may not have the virus at this point? How do I quarantine, or what does that look like?
Well, okay, so to quarantine, if the person did have the virus first, you would basically limit contact with the patient. You definitely have to be there with them, but you would limit contact, and that means just maybe you being that contact person, not having anyone else come in contact with the person. So you want to limit the contact with your loved one. Then you want to, if you have a two bathroom facility, home or apartment, or wherever you're caring for that patient or that person, you want to have them just use that restroom. Now, and sometimes you don't have two bathrooms, so you want to make sure they have their own towels, make sure they have their own toothbrush, their own cup, and things like that. And you want to disinfect that bathroom once a day with, we said, the disinfectant wipes or your bleach solution. You also want to wear masks. I would place a mask on the patient as well, on the loved one, as well as the caregiver, because when you cough or when you talk, those particles droplets can come out of your mouth, or when you sneeze, and those droplets can get into the air and expose you and affect someone else. So I will basically limit myself contact, like I said, gloves, mask, and disinfect.
And it's one of the things we've done in our house, is that we have said we are securing our borders.
Yes.
We're not letting any outsiders come into our borders if we can help it. Right. It's like we plead the blood is over our borders. That's and right. We're doing what we can to help protect each other. And that if they go out, they do the mask and the gloves and everything. But you know what? It's really tough, though, when you're caring for a loved one with dementia or some other disease, because it's our nature to hold them. It's our nature to hug them. It's our nature to touch them. And especially when we see them ill, we want to do more because caregivers, that's our heart. That's who we are. Right. That's really tough.
It is. I'm a hugging person myself. And my first instinct is to come and give you a hug. However, we're in the day and age now, we may just need an elbow bump or a fist bump, or something like that. But I know, but it is tough. But we just have to just comply for 14 days, and you should be should be okay. At the same time, though, this virus is highly contagious, and so we really want to comply as much as possible, and just maybe blow them, but not even blow them a kiss, but a kissing gesture, or like I said, just an elbow bump. I know when I see my parents now, they're up in age, and I stop at the door. They have their gloves, their mask. I bring them groceries at the door, and I just give my father an elbow bump, and I, wave at my mom, and I keep it going. They know I love them, and as well as they know they love me. So just got to comply. Just have to comply and stay prayed up, like you said.
Yes. So the quarantine period is 14 days from the point at which, from what point is 14 days?
Well, usually they say of the first time you were exposed. So when you start the quarantine is usually by the time you start quarantine, you basically had some symptoms. You went to see, your primary care physician, or you went to the ER. They say, look, start the quarantine process. However, prior to that, you've already been exposed. And so the virus at that point is more, has probably more contagious at that point prior to when you even had the symptoms.
Mm-hmm.
So the quarantine usually starts at that day of exposure, or that day you come into the physician's office or the hospital.
Okay. Now, you know that a lot of people don't have insurance.
Yes.
So I'm sitting at home feeling that my loved one needs to be, I have to be honest, I used to take her to the emergency room. And that was my only option. I didn't have a primary care doc. I would just take them to the emergency room. That can't do that now. We really shouldn't do that now. Can I get served if I don't have insurance?
Yes. Yes, you should. Yes. If you come in, you're symptomatic, you let the hospital know what happened, or if you've been exposed and you're having these symptoms, yes, you can get served. To turn someone away due to insurance at this time, I do not believe they can do that. However, you should be able to get served. Yeah, absolutely.
Should I call the hospital first and say I'm coming and give them a description of everything, or that's probably the best route to go, or what do you think?
Yes. So what I'm saying, what I'm telling patients now, that if you're having symptoms, I would say if you're having these symptoms, that's a dry cough, low grade fever, and some shortness of breath, I would say, start your Tylenol right now as needed for fever, increase your fluids. However, if you have shortness of breath, but you're able to still get around, I would say hold off before you go to the ER, where it's highly infectious and you can become worse. Now, if you have worsening shortness of breath, where you can't you can't get dressed, you can't go up and down the stairs, and you're having trouble breathing at rest, you need to come into the hospital. Because a lot of times, if you're just having two of those symptoms, you get to the ER, they're going to turn you away, send you back home. Because right now, you're better off at home recovering than in the hospital recovering, unless oxygen is required.
Okay, thank you for that. So if I were going to put together a COVID-19 emergency kit,
Yes.
what would I put in my COVID-19 emergency kit?
Okay. I would put gloves. I would put disposable gloves. I would put a mask. I would also put goggles. If you don't wear glasses, some goggles or something like that, because again, those droplets can enter, go through the mucous membrane, go through the eyes, go through the mouth, things like that. I would also have disinfectant wipes. If you don't have those, like I said, we can put together a mild bleach solution. I would also have hand soap, hand sanitizer, dish washing soap. That would be something I would also have as well. And if you do have any type of if you have the elderly at home as well, you want to make sure they have definitely some fluids and things like that.
Okay, and it's funny, I thought about it the other day and I realized I didn't have a thermometer in the house.
Yes,
and you never think of a thermometer as something you need until situations like this.
You need your thermometer, and you need some Tylenol. You definitely need some Tylenol as needed for that low grade fever, because you will have that, and the Tylenol will help with the body aches that you'll have. The Tylenol will definitely help with the fever as well.
Okay. And let me say that I appreciate that guidance. And I think you and I both say that they need to contact their own doctor first,
Yes.
and that what we're providing is supportive information and sharing, but you need to contact your own doctors. And if you don't have one, contact the hospitals directly so that you can get specific guidance and direction from a professional in that they can touch personally.
Yes, and they do have a Michigan, they do have a hotline. I did write it down here. They have Michigan has a statewide hotline, COVID hotline, from 8 a.m. to 5 p.m. that you can call, and that number is 888-535-6136. And that's a hotline number that you can call, and they'll have, they'll answer your questions, but that's a statewide hotline number. And I also have the number for testing as well, as far as if you were requiring a COVID test, that number is, or if you wanted to get tested, again, you would need a prescription from your physician, but you can call starting at 9 a.m. To schedule testing, and that's 313-230-0505. That's the curbside testing scheduling number on 8 Mile and Woodward at the State Fairgrounds.
Great, thank you for that. One last question, because I said I'd only keep you, I know you're busy, I was going to keep you about 30 minutes.
Okay.
Is that one of the ongoing challenges of caregivers is that they don't often care for themselves.
Yes.
They're so busy caring for someone else that they don't care for themselves. One of the things we're trying to make sure they do is that they do a little exercise, that
Yes.
to keep the body moving, because you can always, that improves your mental state, because it's so easy to get down and depressed as a result of this.
Correct.
What are the kind of practical little things which you think about telling a caregiver on how to take care of themselves in this process?
So first of all, I would say if you're not taking any type of multivitamins, I would say if you can, start a multivitamin regimen, multivitamins that are, rich in vitamin C, B complex. Those vitamins help the immune system. And so you want to have a strong immune system, just in case this may happen, or you may have some type of symptoms, and you want to have an immune system that can fight this off. So I do encourage multivitamins. I do encourage, like I said, vitamin C, whether it's orange juice or whether it's the Energy C pills or airborne pills you can take to put right into your drink to help build your immune system. Also, exercise. Just some walking in place, walking in even around in your neighborhood or something like that, just to get your lungs working stronger, things like that. When you sit in place, you become depressed, your immune system drops as well. And so you open yourself up for those viruses to come on in because you're not protected. And so, just to get out, get some fresh air, do a little brisk walk, even up and down steps, or like I said, you want to take some type of vitamin C or multivitamin just to keep your immune system strong, or keep.
Okay, great. We would also do some recommending that, because we are in a level of isolation, pick up the phone every now and then and call someone just to talk to them. They will change your mood. There are people in your life that have a positive attitude about almost everything. So it's important to talk to somebody who can help uplift you, as well as sometimes you got to speak to your own self and say, you know what, this is the moment we're living in. It won't be like this always. It's going to change. And I just believe it's going to change for the better. So I'd say do that. Do some affirmations for yourself. One of the ones I use, I wake up first thing in the morning, I do, because both of my parents had dementia related diseases. I always say, today is Thursday. I know today is Thursday. Well, that tells me I don't have dementia at that moment. So I'm reinforcing something positive in my energy. Today is Thursday, and I remember it's Thursday.
Right.
So we have to find little things to be grateful for, because there are so many little things to be grateful for, even in the midst of this crisis. So Roe, I really appreciate you. What I didn't say is Roe took care of my mom and helped me take care of my mother and father. And I want to tell you how much I love and appreciate you having been such a kind person with my parents.
Thank you so much. And thank you for giving me the opportunity to take care of your parents. Anytime, if you need me, just give me a call. I'm there.
Thank you very much. And we want to tell you out there, if you have any questions for us or Dr. Goodson, I call him Dr. Goodson, feel free to send us a note at Facebook, or you can contact us on our website or at our email on info@universaldementia.org. Send us questions, things that we can add value for, and know that there are folks out here pulling for you, that are praying for you, that are available to try and offer assistance if we can. And there are a lot of folks out here trying to offer assistance. Utilize it, but don't let the scams get you. So our next session, for everyone that's watching, our next session is on Tuesday at 1 o'clock. We have Dr. Portia Lockett, who's coming to speak to us, and we're going to talk about grief, because there's so much grief around us and so many losses around us that we just need to talk out loud about what grief is, how it feels, and some of the things we need to do to manage it. I'm Dr. Paula Duren. Thank you for the gift of your time. Dr. Goodson, thank you. And thank you out there for participating with us. Have a blessed and wonderful day.